And once patients are tied in with you, I was reading a little bit about support groups and how you help patients as well as their families deal with some of the intricacies of heart failure and heart disease. Tell us a bit about that.
Sure. So, disease process like end-stage heart failure doesn't just affect the patient, it affects their whole family. Because the patient may be the one who's very ill, but the rest of the family has to take time off to, bring the patient for visits, for doctor's appointments, to go to the hospitals. It really can have a big toll on the family itself. So we have a very popular and very successful support group for our LVAD patients. So all the patients who get LVADs, or patients who are considering getting LVADs, or patients who've had LVADs placed and then have gone on to get heart transplants, come to these meetings that we have once a month, which are really a great chance for them to all meet other patients who are in the exact same situation that they are. It's a great chance for their families to meet each other. Our patients all refer to themselves all as one big family. They're LVAD family. And it's great for patients who are contemplating having surgery or have just had surgery, have had surgery many years prior, to all share their experiences, to talk about the ups and downs, the good and the bad of living with heart failure, living with LVADs, and they get to share their experiences in a setting where they're amongst their peers.
So it sounds like this is a comprehensive heart institute at Maimonides, and you have the congestive heart failure specialist, the cardiologist, you have the surgeons working on heart failure. Tell us a little bit about some of the other new and exciting parts of cardiothoracic surgery outside of heart failure that you're working on there, whether it's valvular disease or other heart diseases.
So similar to the transcatheter aortic valve replacement, the TAVR, we also have newer, innovative, less invasive approaches to treat mitral valve disease. So people with what we call mitral regurgitation or leaking mitral valves. Again, this also frequently affects people who are very old and very sick and very frail and could not really safely undergo open heart surgery. So there's now a device, essentially a clip called the MitraClip, which can similarly be implanted through a small procedure, a small puncture in the groin. And this clip goes in and basically clips the mitral valve leaflets together and holds them together and reduces the amount of leakage dramatically. So for someone who's too sick or too frail to undergo traditional open heart surgery, this can be a lifesaver and get a game changer because it reduces the symptoms associated with the leaking mitral valve.
What are some of those symptoms that you might see with a mitral valve leak?
So similar things like difficulty breathing, shortness of breath, weakness, fatigue, patient being very tired, fluid building up in the lungs, all these similar sorts of, it can produce similar symptoms to heart failure.
And do these affect predominantly older patients, say over the age of 75, or can these diseases affect patients of any age?
They can, mitral valve disease can affect patients of any age. Patients, even young patients, can get mitral valve disorders and mitral valve diseases that cause leaking that can require surgery.
Is there a predominance of male or female? Is that something you see more in one than the other?
It's pretty split. And thankfully, traditional mitral valve repair surgery is very, very safe. It's one of the safest operations we do, and it's very effective. And when it works, when patients have this and have a good result, they can have a long-lasting result that can really last them the rest of their lives.
So for our viewers out there watching today, these are diseases that can affect us at any age and across male, female. What are some of the risk factors that people can identify early on in their life that might predict that they're going to suffer from aortic stenosis, that you described the need to replace the aortic valve, that might predict that they're going to end up with heart failure one day or mitral disorders? What are some of the things that they can look out for in their health now that they could modify or might predict that they're headed down this road? Sure.
Well, a lot of things we talk about in heart disease are affected by genetics, and as we say, you can't pick your parents. So a lot of those things are not modifiable, but there are a lot of modifiable risk factors for heart disease in general. One of the biggest one that's modifiable is smoking. Smoking can negatively impact health in many, many ways, especially in terms of heart disease. Can significantly increase the risk of having coronary artery disease, blockages in the arteries in the heart, as well as a whole host of other lung diseases and cancer, as we all know. So smoking is probably the number one most modifiable risk factor that we can.
And the way we modify is just stop smoking.
Stop smoking, yes. Exactly.
Okay.
Also, in terms of modifiable risk factors, are things like diet. Diet and watching our cholesterol levels are things that we can easily, when I say easily, but things that we can modify with diet and with medications. Other things are patients who are diabetic is watching their sugar levels very carefully and making sure their sugar levels are kept well under control. That will help, help a lot in terms of modifying their risk for heart disease. Those are some of the biggest ones we talk. Also, the level of activity patients get.
Exercise,
so exercise,
right.
is good for really everything, and constant, daily small amounts of exercise are beneficial in lots of different ways.
Yeah, patients in the office are always asking me, how do I prevent this disease? How do I prevent that disease? And so here today, when we talk about heart failure and valvular disease, obviously smoking is huge, and it's so difficult to get our patients to quit. You mentioned exercise, watching our cholesterol, for diabetics, keeping the blood sugar under control. We talked a lot about heart disease, and we talked a lot about what you can do to help with heart failure and valves and some of these minimally invasive techniques, which are all very exciting. Patients can look out for some of the symptoms you described, and you're able to help them here. Now, if they need to go on to transplant here in New York, how difficult is it for them to get a transplant? How long are they waiting on average?
Well, it's funny, yes, because actually this month, April, is actually Organ Donation Awareness Month, and we're doing a lot of outreach with that and a lot of education at Maimonides. We work with Northwell Health's transplant program. We were part of their application to get that transplant program started in the last 2 years. And we've worked with a number of different transplant programs over the years in getting our patients who need access to heart transplant seen at heart transplant centers. Heart transplant, any transplant, is a difficult process because, as we all know, the biggest problem is not the inability to do the transplant, is to have the organs. The U.S. And the entire world is really suffering from a shortage of organs and organ donors. So we encourage everybody to become an organ donor, to sign your licenses, to make your family and friends aware of that, because you might be saving a family member, you might be saving somebody else by donating an organ if that need arises. But that's the biggest impediment to heart transplant or any organ transplant, is the lack of organs.
The availability of organs.
Right. There's far too many people with heart failure than there are for the number of organs that we have.
There's increased demand, but not enough supply of
Exactly.
organs. And I was just, as you mentioned, this month is Organ Donation Month, and I was at an event where they were mentioning that an organ donor can save at least 8 lives.
That's true, yeah.
And it's really incredible for our viewers. We talked on how to prevent heart disease today. We talked about how to treat some heart diseases. But this is an important discussion of how we could actually help other people with their heart disease by being organ donors. And that's very important for some of the patients that we talked about. You really educated us a lot about what you do. Tell us a little bit more about you. Where did you grow up, and where did you attend school?
So I grew up in Manhattan. I grew up born and raised in New York City, and I went to high school in the Bronx. I left New York for a few years to go to college, and then I came back to New York to go to Mount Sinai for medical school, and then spent a number of years at NYU learning general surgery and cardiac surgery before I moved on to Brooklyn.
And I think you mentioned earlier, but how many years does it take for someone to train and become a cardiothoracic surgeon like you?
So for me, it was about 9 years. I did, again, 7 years of training, 2 years of research in that time. So about 9 years altogether.
Incredible. What's your favorite part of the job now?
I think the favorite part, I think a lot of my colleagues would say the same, is when we get to help patients. We help a lot of patients all the time, and we obviously have specific cases or patients that that really sort of strike a nerve. The patients that we've really worked very hard on. For myself, I've taken care of some patients who were very, very sick, where we weren't really sure we were going to get a good outcome, and when we do get good outcomes, the patients come back and have gone on. I just saw a patient today who I was fortunate to take care of about 5 years ago, and she was a very young woman, and she was very near death, and she's gone on to live a great life. She came back today with her son, her husband, to come back and visit people, friends at Maimonides. And cases like that are really the reason why we do this, the reason why we put in the long hours of training and work the way we do, because it's in the end we do it for the patients.
Yeah, I think the reward, like you described, that, how we see patients in our office and they thank us for giving them back life or continuing their life or extending their life, making them healthier, makes up for the 9 or 10 or 15
Sure.
years, whatever it is that we spend training. And it's really great to hear these things from you. And aside from you being at Maimonides, tell us why some of our viewers might choose Maimonides for their cardiac care.
So, and as I alluded to, we have a great heart team. We work together. My colleagues are from cardiac surgery as well as cardiology. We really work well together, and I think that's really the key. We decide what's the best for the patient, not what's best for us. If it's a procedure that we can do, we're going to do that. If it's a procedure we feel is best to be done by our colleagues in cardiology, we'll do that. So we're really looking at making the best decision for the patient, not for the doctors. My colleagues in cardiology have some phenomenal results. They have results that are that in terms of treatment of acute heart attack are the best in the state of New York. And we provide really the full spectrum of care for anything you need for heart disease, really, at Maimonides. So we have a huge team, a great team of doctors, nurses, all different professionals, really working with a single focus to take care of the heart.
And the message there is that for our viewers today who are watching in Brooklyn, they don't need to jump over the river and cross to Manhattan or elsewhere to seek out great cardiac care.
Absolutely. We provide really, as I said, the full spectrum of care for the heart, and we provide it in a facility that gets outstanding outcomes that are unmatched in New York State or in the country.
So, Dr. Saunders, where in Brooklyn are you located?
So we're located in the Borough Park section of Brooklyn, just off Fort Hamilton Parkway.
And if patients or viewers today are watching and want to get in touch, seek out care with you at Maimonides or the other heart specialists, how can they get in touch with you?
So they can reach us through by telephone 888-MMC-DOCS or on the internet at maimonidesmed.org. So
888-MMC-DOCS, Maimonides Medical Center DOCS, D-O-C-S, and maimonidesmed.org. Right. So as we come to a conclusion today, I really want to thank you for coming here. We have some Brooklyn questions or New York City questions. Now, it's easy because you were born here and you're a true New Yorker. But Mets or Yankees?
Yankees.
Oh, gosh. Knicks or Nets?
Well, I grew up Knicks, but now I got to say Nets.
Is that because Maimonides sponsors the Nets, or?
I think it's just. I think
it's a Brooklyn thing.
I think all Knicks fans have to be going to hiding. So.
Right. Okay. Well, listen, it's really been a pleasure having you on the show. Next time you come on, you're going to tell us your favorite pizza place and your favorite restaurant. And really, thank you for taking care of the folks of Brooklyn and creating such a world-class program in heart disease and heart failure treatment, and this incredible technology that has really, really taken off locally, where folks don't have to travel across the river and they can seek out care with you at Maimonides Medical Center. I want to thank you for watching this episode of Medcastplus. I'm your host, Dr. Jack Braha. You can reach us at medcastplus.com or call us at 718-510-2103. And to all of our viewers out there, stay healthy. See you next time.